Our lecture today is application, finishing and polishing of composite restoration. The clinical techniques of composite restorations include: first step is local anesthesia, then cavity preparation, 3. Shed selection. Of course, a shed selection by the shed guide. 4. Isolation of the operating site. We must have complete isolation for the operating site from the saliva, from a blood, from any fluid surrounding the tooth which had been prepared. How to do isolation? Number 1, by the rubber dam, with or without retraction cord, cotton rule, saliva ejector, sucker. All these tools must be used during the composite restorations. The procedure of composite restoration. Criteria for shed selection. The first step after anesthesia, then preparation, then isolation, the shed selection. As we said, we have a shed guide as here in the picture, and we select the correct shed for the natural teeth. How we select the shed? Number 1, we must have good lighting. Number 2, 1, hold the entire shed guide near the teeth to determine the general color. Good lighting is necessary when the color selection is made. Natural light is preferred for selection of shades. The shed tab should be partially covered with the patient's lips or operator's thumb to create the natural effect of shadows. The selection should be made as rapidly as possible because physiological limitation of the colors receptors in the eye make it increasingly difficult to distinguish between similar colors after approximately 30 seconds. So we must choose the correct shade before 30 seconds, unless we must have to do. The eye should be resetted by looking at a blue or violet object for a few seconds. As we know, the cervical area of the tooth is usually darker than the incisal area because of the dentin, and the enamel will be thin in the cervical area than the incisal area. Final shade selection can be verified by the patient with the use of hand mirror. يعني نعطي. We must give the patient a mirror and to see the final shade selection. If additional shades are needed, they may be obtained by mixing 2 or more of the available shades together. If we can't select the approximate shade for the tooth or teeth, sometimes we do mixing of 2 or more of the available shades to obtain the last correct shade. To be more certain of proper shade selection, a small amount of material of the selected shade can be placed directly on the tooth in close proximity to the area to be restored and cured. يعني ممكن ناخذ some of the materials from the tube and put it on the labial surface of the tooth prepared to be ensured that it is the correct shade had been selected. So after we finished the shade selection, we pass to another step, which is the acid etching, preparing of the tooth structure for accepted the restoration. Once the tooth preparation has been completed, the prepared tooth structure is ready for the composite insertion and finishing. Treating the prepared tooth for bonding requires etching and then application of an adhesive. As we said, we must put the acid etching, then we do bonding, then we added the restoration. And as we said before, we must do isolation before application of the acid etching. So isolation, as we said, by the rubber dam, retraction cord, cotton rule, saliva ejector, sucker. So the acid etching technique requires that a very exacting sequence be followed if optimal results are to be obtained, including isolation from fluid, saliva, sulcular seepage by using either rubber dam or cotton rules and or a retraction cord. We have acid etching many types, either liquid or gel. The most appropriate is the gel because it is attached to the surface than the liquid, which is slippage from the surface. The etching gels can be placed carefully, but usually a syringe applicator is used to inject the gel etchant directly on to the prepared tooth structure. If we use a liquid etchant, they are applied with brushes or endodontic paper point held in a cotton layers. An etching time for both dentin and enamel is considered sufficient, 20 seconds for enamel and 15 seconds for dentin, as we know, because the dentin contains more organic than the enamel, which contains an inorganic substance. The area is then rinsed with water for 5 seconds, starting on the adjacent tooth to prevent possible splashing of acid-rich water onto the patient or dentist or assistant. Then after acid etching, washing, the area should be dried with clean, dry air from the air-water syringe if only enamel has been etched. Dried etched enamel should exhibit ground, glass or lightly frosted appearance or chalky appearance. يعني احنا حتى نتأكد انه حصلنا على etching surface, we must see the ground glass or chalky appearance on the surface of the enamel. That means our procedure is success. If this appearance is not evident, the enamel must be etched again for an additional second. If both enamel and dentin have been etched, then the area must be left slightly moistened. Here in this picture, as you see the acid etching, then after that washing and dryness, and we see the chalky appearance of the enamel surface on the anterior teeth. That means that the etching is success. Then, as we said, after acid etching, washing, drying, we left the surface moistened, because if there is over drying for the etched enamel surfaces, that compromises dentin bonding as a result of the collapse of collagen network in the etched dentin layer. This collapse prevents optimal primer and adhesive penetration and compromises hybrid layer formation. يعني إذا عملنا over drying للarea, that means راح يساعدنا collapse and closure to the micro undercut holes, which is lead to prevention of the penetration of the primer and bonding and which lead to the failure or the formation of the hybrid layer. So the surface must be moistened, not dried. Once the enamel and dentin is etched, rinsed, and left appropriately moist, the primer is applied to both surfaces. Sometimes or most contemporary bonding system combine the primer and adhesive into a single bottle. يعني ممكن أن يجينا 2 bottles, primer then adhesive, or the primer and the adhesive is combined in a single bottle requiring only one application. After that, mix slightly drying and curing. Slightly drying in order to penetrate the adhesive and the primer into the dentinal network or the dentinal or microscopic holes in the dentin, so the primer and the adhesive will penetrate these holes and make a completely bonding with adhesive system. After that, make slight drying and curing the bonding agents for about 10 to 20 seconds. Here in this picture, the adhesive is alone in one bottle and the primer in other bottle. As you see in this, which is the opti bond, الادهيزف بواحد والبرايمر بواحد. نعمل application للبرايمر, then we applied the adhesive. Matrix placements. A matrix placement is a device that may be applied to prepare tooth before the insertion of the composite materials. مثل ما نعرف احنا بالأملغم كان عندنا الباند والماتريكس retainer. So in the composite also we have matrix retainer. It fits around part or all of the tooth being restored and functions primarily to provide appropriate proximal contact and contour and prevent major excess of the restoration material beyond the preparation margins on the proximal surface, especially in gingival margin. It should be relatively easy to apply and remove. مثل أملغم عندنا بحالة كلاس 2 نستعمل ماتريكس باند اللي ميتال وريتينر. هون عندنا ماتريكس بليسمنت. different types of matrix نستعمله مع الكومبوزيت also to help the composite restoration inside the cavity and to prevent the slip. Here in this picture, as you see, the matrix retainer and band and also the wedge, which is separated the adjacent teeth from the prepared tooth. As we say that these for prevention of overhang filling, slippage of material between the adjacent tooth, as you see, for preparation involving the proximal area, polyester matrix strip or cellulose strip is placed between teeth before the acid etching is applied to prevent inadvertently etching the adjacent tooth. To prevent the etching of adjacent tooth during acid etching technique, so we put the matrix strip and to prevent this to prevent the etching material touching the adjacent. Here, as you see in this picture, the application of the rubber dam retraction cord, celluloid strip, and the application of the composite restoration inside the prepared tooth and contouring of the filling material and good adaptation to the surface of the tooth structure by the special type of composite resin material. Here sometimes when we have a complete destruction to the crown of the tooth, we use what's called a ready-made celluloid crown for the application of the composite resin. We do manipulation to the celluloid crown، يعني ممكن ناخذ الكراون ونقصه ونعمله ونرتبه بحيث يجي عندنا to fit the missed crown of the tooth. After we do acid etching, bonding, isolation, celluloid strip or crown, so the tooth or the cavity is being ready to accept the restorations, it is important that the material to be inserted into the tooth preparation in 1 to 2 mm thickness. So the material not exceeded more than 2 mm. Why? Because the light cannot penetrate these layers. So we put the composite layer by layer and the thickness of the layer not more than 2 mm, because this allows the light to be properly polymerize the composite and maybe reduce the effect of polymerization shrinkage, especially along the gingival floor. The time for curing is about 40 seconds for each layer until we filled the restorations. Additional light cure may be used when we have class 2 or class 4 cavity preparation to the proximal area after we remove the celluloid strip or celluloid band. Either a hand instrument or syringe can be used for inserting light cure composites inside the cavity. ممكن نستعمل special type which is called the plastic filling instrument for the composite restoration, or we can use the syringe special type or syringe to be handle the material into the cavity prepared. Applications of composite restorations is by different way, either by hand instrument called plastic filling instrument or by a syringe can be used for insertion of light cured composite. Here we have different type of composite restorations, either in tube, capsules. So the application of it either by the syringe or by this type of gun, special type for capsule type of composite restoration, or can we use a special type of hand instrument which is called the plastic instrument for application of the composite inside the cavity and then cured by light cure. Here in this picture we have different type of composite as in a tube or in capsules. This type either in tube can be injected in the cavity by special type of syringe or can be held by special type of hand instrument called plastic filling instrument, and the capsule can be added the material inside the cavity by special type of gun used this type of capsule of composite material. After insertion, polymerizations of the composite material, the matrix and wedges are removed. The restoration is cured again from different angles by a light cure device, and the restoration is examined if there is any void, slack or proximal contact, so to be corrected any defect and should be accomplished at this time, because any addition will be bound satisfactorily to the uncontaminated surface layer of the composite material. So if there is any voids, lags, defect in contact area, can be at this time will be repaired. Contouring and finishing and polishing of the composite restoration. While during the application of composite inside the cavity, we need to good technique experience in insertion of composite so that we will reduce the amount of the material and reduces the time for finishing and polishing of the composite. We use coarse diamond instruments can be used in removed excess, but they generally are not recommended for finishing composites because of the high risk of inadvertently damaging the contiguous tooth structure. Finishing burrs. As you see in this picture, different types of finishing burrs used for finishing and polishing of the composite restorations. Diamond, ceramic burrs, etc. Polishing burrs used in polishing of composite restoration, as you see in this picture, silicone burrs, polishing wheels, all these types of burrs and wheels used for polishing the composite restoration. Aluminum oxide polishing paste should be used in the polishing of composite to obtain a smooth, blistering surfaces of composite restoration. Here in this picture we see some type of abrasive disc have different degree of abrasiveness depend on the amount of the excess to be removed, which is a disc shaped will be mounted on a mandrel specific to this type of disc in an angle handpiece at low speed can be substituted for or used after the finishing burr or diamond, in special areas. In this picture we see for more or further contouring and finishing of proximal surface can be completed by different types of strips which has different colors, which is used also for more contouring and finishing of proximal areas as in class 4 and class 3 cavity preparation. Proximal and embrasure areas. It is very important to finish and polish the proximal and embrasure area if there is overhang filling or excess material in between the gingival portion and the tooth structure. The proximal surface contours and margins should be assessed visually and tactilely with an explorer and dental floss. The floss should be positioned below the gingival margin and is pulled occlusally if there is any catches of the floss in the proximal area. Additional finishing is needed for this area. A sharp gold finishing knife or number 12 surgical blade mounted in a barred Parker handle is well suited for removing excess material from the gingival proximal area. Here, as we see in this picture, we removed by special type of instrument the excess or finishing the contact area or the embrasure area of the restoration. Repairing composite restoration. Now, if we had a defect in composite restorations and there is a need for repairing this restoration, if patient presents with a composite restoration that has localized defect, a repair usually can be made. Easily accessible areas may be roughened with the diamond stone. The area is etched. Primer may be applied. If dentin exposed, adhesive is applied, and finally the composite is inserted, contoured, and then polishing of the restoration. But if the defect is not easily accessible, a tooth preparation must be created that exposes the defective area, and matrix ban may be necessary. Placement of the etchant, priming, adhesion, and then putting of the composite restoration. But if we have a void, or if a void is detected immediately after insertion of composite restoration, but before contouring and finishing and polishing is initiated, more composite can be added directly to the void areas and continue polishing and finishing. Thank you for your listening.